This is the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
Welcome, listeners, to the second part of our program. If you've been listening in the past, we've been touching on some very serious topics and far, far more common than you may think. Tonight, we're pleased to have back Colleen Butler. She is going to be one of our regular guests. Colleen is the managing director of Brain Navigators, a one-on-one coaching program that supports brain injury patients through a holistic approach. Now, after suffering through a brain injury herself, Colleen is working to address the gap between the patient and the healthcare system when it comes to these types of conditions. This often happens some 6 months or more after the person has entered care, and then the long phase of recovery of brain injury continues. Colleen is also the author of the book Concussion Recovery, Rebuilding the Injured Brain. Welcome to the show again, Colleen.
Thank you, Dr. Don.
So since we talked to you last, the whole Christmas season has come and gone, and how did that go for you with your work in the Brain Navigators?
It actually went really well, thank you very much. I had a little personal break, and it was just probably what the doctor ordered, and getting ready for this next year with added zest and enthusiasm.
Well, that's probably a bit of a challenge for people who have had some form of concussion brain injury. In the shows that led up to our interviewing you, we also came across a bit of a research article which I found was extremely significant for a couple of reasons. And you may remember this one because I think I hope I covered it off with you before. And that was the one where there was a 1,200 patient study done with MRI. And the significance of this was that it was done with weight bearing, meaning people weren't receiving their MRI laying down. So along with doing an MRI of the brain stem where it squeezes through the skull, the MRI detected the effect from car crashes as opposed to people who had not been in a car crash. And there was a significant increase of findings with the MRI where the brain stem was sort of being squeezed into the area of the opening of the skull. But when these people were, half of the 600 people in the car crash, half of these 600 people were also sitting for their MRI. And when we did the imaging of the brain stem, and the skull area, the increase in the findings was up about 300%. Now, the fact that we had the MRI, whether it's laying down or sitting to begin with, was really significant for people having been hurt in a car crash who have these lingering brain injury symptoms that I'm going to have you talk about. But for those people who were beneficial in having their image done sitting, it was up, the finding increased 300%. And this is a hard physical evidence identifying where there was an injury, and in this case, a form of brain injury. So I think this is just huge. That probably helps you and the people you're working with understand that, yeah, something actually did happen, and we now can quantify where and how that happened.
Oh, that's exactly right. Like, the biggest problem is the diagnosis, and so many problems people fall through the loops and the holes in the system is because they're not getting properly diagnosed, and not everybody has those machines that can tell you. So, you know, you get so nervous and you go to your doctor and you pull it together so much because it's so important to go there to tell them what happens, and then you fall apart afterwards for 2 or 3 days, and it becomes really a hard injury to diagnose. So any part there where they can come across and improve it is absolutely wonderful.
Now, we'll ask our listeners that if you're listening to us on the internet, we'd be happy to take your emails to radio, R-A-D-I-O, radio at bcchiro, that's bcchiro.com, or if you want to call us toll free and speak to our guest, Colleen Butler, about recovery from brain injury, Vancouver, the local number is 604-280-0650, and long distance toll free it's 1-877-280-0650. Now, Colleen, your experience with brain injury was somewhat significant, and how did you find the ability to diagnose and treat that?
I found there was really nothing. You really fell between the cracks. If you were excessively crushed, your head was crushed and there was bleeding and, your brains were just about falling out, you had help. And as long as you're in the hospital and you're under that really critical care, you're okay. But the moment that you become a little bit more able to function and you look pretty normal, the demands on the system is so high, you get thrown out of the hospital and virtually left on your own because nobody knows what to do with you. You have your crazy thoughts, so you go to a psychiatrist and they diagnosed you as being virtually psychotic or suicidal. Like suicide and depression is so high with people with brain injuries. And that's the part that gets really deceiving, is all of the side effects and the symptoms may get directed by, or you may get help from, but it doesn't go back to the cause. So it's quite a bit of Band-Aid effect.
Well, it's understandable, I suppose, that after a period of time being in the hospital looking after the life-threatening and acute injuries, even those that are associated with brain injury, for some people they will be discharged. The problem, and of course that's going to make room for other people who have had the tragedy and trauma of a like occurrence. But the problem is, and I think you pointed out, is that we're not paying enough attention to the fact that these events, they don't go away in 2 months, 3 months, 6 months. They go on for a lot longer. And the support system, as well as the treatment, is lacking to help the person with their family, with their work, and just simply with themselves.
Well, that's exactly right, because even as having the brain injury yourself, you're starting to think that you're okay. You don't want to be incompetent or anything, so like you're trying, and really your thought pattern, your processing, it just isn't there. So it's really like your brain is your computer, and you have the accident defragged you, and now you're having to put in new information. So it does take a while to regain new thoughts. And, if you can kind of imagine your brain as being like Swiss cheese, and once it's had the accident, it becomes Swiss cheese. So all the connections and all the routes going in and around your brain, they're having to skip and go over different areas. So the communication isn't as easy.
Now, we had several people contact us after our past programs that we did with you and the other expert that came via the conference that you were at back east. And we had a number of people, and it was very, very, I tell you, it was very, very moving to hear their comments. And when they heard your interview as well as the other doctor that we had, we recognized that there's a real need out there, because these people were contacting us after the show, and they really resonated with the attempts that you're trying to provide in your counseling help. So what is the number one thing that patients and family members should know about brain injury? Because they're the ones that are going to be coping with this for long times after the discharge from the hospital.
Well, there's many things, and I think the expectations that we get put on us, that you look fine, therefore you are fine, and you should be the same person. And no one really likes to have their worlds upset or disrupted, whether you're the partner of the person being who was concussed or not. Like, everybody likes to go on as though they are, and nothing is the same. So beware of the differences and releasing the stress. The stress that goes on the brain is so incredible, whether it's putting on your shoes or getting out the door with the right car keys or the traffic. All of these little things add up to be very, very whole. And it's being aware of the bathroom fan, the type of lights, it's the noise. You don't socialize the same way. Too many people cause an overload quite often, so you get exhausted. So sleep is critical. And being aware of depression and being aware of suicide, the person is not, it sounds weird, but they're not crazy because they have suicidal thoughts. The negativity is really high, and so we're having to retrain the brain to have more positive thoughts so that you wake up happy and you wake up more normal. So there's all sorts of little things that we don't think is very healthy. And this part about suicide, well, you get into thinking, oh, well, that's like such a mental illness.
No.
And in reality, the thoughts are there, and if we don't start identifying it, there's going to be more and more suicidal people. They did a study with the University of Toronto, And they found that 70% of homeless people had acquired a brain injury prior to being homeless.
So they just got caught in the system and ended up losing their family, their work, and their income and ability to sustain themselves.
That's exactly right. They go back to work trying to be the person that they were, trying to function with the expectations of them being the same person. And in reality, what happens is they go back, they get fired, there is nothing in the system. Now they're fired. And if they were fortunate enough to get any kind of subsidy, that's gone. And they start making, the choices they make are less and less and less effective for them.
So you said this was a University of Toronto study, and they identified 70% of the homeless had some form of brain injury prior to becoming homeless?
Yeah, 70.
When was that? Do you recall? We're going to look that study up because that's really significant to, well, just to everybody, obviously the person themselves and their family. But when we look at homelessness and that issue alone being a factor in society today, if we can track down some of these causes relative to a trauma of some kind, well, that's huge.
Oh, that is absolutely enormous. And this is, I think, why I become so passionate, because we either pay now or we pay later.
Now, in your work with people with brain injury, what are some of the first things that you do to help them cope or help them heal, or both?
I make them realize they are only temporarily crazy. They're not crazy. It takes time, just like your previous person that you were interviewing. It takes 3 weeks for your diet to kick in. It takes time to start to heal. And it's normal. So many things that we do are normal. As a matter of fact, I asked in our last class, and I said to them, how many of you have really been honest about your feelings and about the thoughts that have been going through your brains? Not one person would have been honest. They felt comfortable where they were because there was no judgment, and I wasn't going to stick them in a cubbyhole and put them there. But that's what I thought was really amazing. So,
Colleen, tell me, do you have a sense, or do you know statistically how long people have been experiencing their brain symptoms before they finally find you in your program?
Nothing really specific. They come when they're ready to be healed, is actually when they finally come. And they have lost everything.
Wow.
The number of good, competent people that have just been broken down to their bare knees have been unbelievable. And they're people, they're not bad people. They have just been caught in a system where they can't function because they've been put back too soon into the world when nobody's given them the right direction for food, for sleep, because the brain-injured person, very few people make it into that fourth REM of sleep, which is where they heal.
Keep that thought for a moment. Listeners, we're talking with Colleen Butler. If you or someone you know has experienced a traumatic brain injury, when we come back, we're going to talk a little bit more about the identification and how to access help for these people. You're listening to the Dr. Don Show, where it's Empowered Health, live on AM 650.
The Dr. Don Show. It's your health, it's your life. On the Astral Radio Network. There's still lots more ahead.